Welcome back to the show. I've got Dr. Jim Talkington, who's an orthopedic surgeon here in Panama City, and actually an old friend of our family who I'm just meeting, and there's a story behind that. Welcome to the show, Jim.
Thanks, Don. Glad to be here.
And our boys have been friends for quite a few years.
Yeah, they have for years, and I've known about you and heard you on the radio, and this is our first chance to meet each other. I'm glad to
actually,
finally get
I think
together.
we met in passing one time at a basketball game when my son was like in middle school or grade school. He had twisted his ankle on a basketball court. And
yeah.
you were going to a different, your son was at a different school. My son was at St. John's, I think, at the time.
Okay.
And you came out on the court and treated him courtside. And I think we met the very first time then. And then, you know, as time went on, our boys became friends, and they had a little garage band together.
They sure did. They sure did. We always enjoyed Nick coming over. Great kid.
Yeah, and the same with Grant. I got to tell you, despite the racket in the garage, they're good kids.
You're right about that.
Yeah. So, Jim, you're an orthopedic surgeon, is it?
Right, right.
It's always kind of fascinated me why people choose different vocations in life. What motivated you to go into this specialty?
Well, like a lot of people, I had others who influenced me in that direction, and in my case, as frequently happens, it was my dad. See, my dad was a doctor, and in fact, he was a general practitioner back in the days when people did house calls.
Oh, geez.
I don't know if you experienced that.
I did when I was a little boy.
Yeah, house calls. I remember him getting paid with preserves, that sort of thing. And ultimately, he became an orthopedic surgeon. And so naturally, I always say a baker's kid wants to bake bread, but my dad was my hero, and so I naturally tended to follow in his footsteps.
And why Panama City? Why is your practice here?
Well, I'm from Mississippi originally, and I trained in Mississippi, but I met my wife during what's called a residency, which is part of the orthopedic training, and my residency was in Jacksonville. My wife was from Jacksonville. I'm from Jackson, Mississippi, and I actually practiced there with my dad until his retirement, and then we wanted to get back to Florida. You know how Florida is. Well, you're in Florida. Hey.
Yes, I am. I'm a tax and toll refugee from New York.
Refugee from New York. I mean, Florida's nice. A lot of people want to come here.
Gotta love it.
Very few people retire from here and go north. It's kind of the other way.
You got that right. It's always the other way around.
And Bay County, people, they come from all over the world. It's just a
Isn't that
nice,
true?
And it's the right size community. And at the time when I came here, which was a while back, I was adding it up, it's actually been 25 years, there was nobody doing sports medicine.
Right.
Nobody was doing the kind of team coverage that I was interested in doing. And you mentioned about Nick. We used to do it for 10 years, my wife and I, and as part of the business I employed athletic trainers, and we covered athletic events for most of the schools in Bay County, many of the schools out of the county, Gulf County, Washington County, and sort of got introduced to the community that way.
Well, you know, I want to talk a little bit more about your practice after these messages, and maybe we can even talk about some of the more common athletic injuries that we need to look out for, maybe how we can prevent them from even happening.
Sure, yeah, that'll be good.
You're watching Waking Up with Don. I'm speaking with Dr. James Talkington. We'll be right back. Welcome back to Waking Up with Don, and thanks for watching. We've got Dr. Jim Talkington here, and he's an orthopedic surgeon, and we're going to talk about some common injuries and how you can avoid them. What is the most common injury that you see, sports injury?
Well, the most common orthopedic injury, period, is the ankle sprain.
Yes, I've had one of those.
I mean, most people have. It's a sprain is an injury to a ligament, and you sometimes experience this rolling of the ankle, and if it's bad enough, it can be almost like a broken bone. It can be 6 weeks or so to recover, and it can become a recurrent problem. So,
because that is very true.
Yeah.
I had sprained my ankle as a young man playing Frisbee. And went to the military dock, and they put me in a cast, in a walking cast. It was a bad sprain.
Yeah.
Fast forward about 3 years, I go skydiving. Sprain my ankle again, very same ankle. They put another cast on, a walking cast. So now my left ankle seems like it's probably weaker than my right now.
Yeah.
What's going on in there, Doc? What's happened to my ankle?
Not having examined you, and I can't speak specifically about you, but I can tell you what's common. What's common is, you see, after an injury like that, there's some atrophy, all the tissues are affected. It's what's called disuse atrophy. The muscles and tendons, they get a little shorter, they get a little weaker, and now some routine activity of daily living, they're not able to accommodate to that. So an important part of that, and it may not have been applied 20 years ago in your case and others, is physical therapy. In other words, once you're done with the rest part, in your case the immobilization, it's real important to bring those tissues back to the strength and length that they were in before the injury, or even better, hopefully, so that you don't experience that same thing. So that's one of the things that sports medicine emphasizes, is the stretching, strengthening, and improving the muscles, tendons, and joints to the point where you're less likely, well, first of all, speed your recovery and then make it less likely that you'll have a recurrent or persistent problem.
So it's not just healing it, it's building it back up to its, or as close as you can get to its previous state.
The rest is just the first part of it. And it depends on the degree of injury about the length of time. There's some nuances to that, but almost universally you're going to need to do some stretches and strengthening.
Stretches and strengthening. So ankles are a big one.
Ankles,
you know, you
well,
probably see some breaks too.
I see a lot of knee injuries. I see, you talk about, you and I were talking about not being 20 years old anymore, calf injuries. There's a common injury that, picture yourself on the tennis court and you're going for a ball and you feel this pop in the back of your calf and you think, well, somebody just hit me in the calf with a tennis ball. But really what happens, there's a place, one place, where the muscle meets the tendon in that calf and it tears. And that's a common injury in the 4th decade of life.
Wow.
Now, it doesn't need surgery, it recovers, but I see a lot of that. And one of the reasons that people experience that is because that muscle tendon unit is no longer prepared to do what you're asking it to do. And so that speaks to the importance of continuing stretching and strengthening through the years in order to maintain your ability to do the things you did in the past.
We've got to run off to another break, but on the other side of that, maybe you can, I saw you brought some models.
I did.
Maybe you can kind of graphically show us what's going on inside of our joints when we stress them out like that.
Be happy to.
You're watching Waking Up with Don. We'll be right back after these messages. Doc, you brought some pieces and parts here with you.
Yeah.
That's a medical term.
It is.
That I just invented.
Or props.
But we were talking off camera about knees.
Yeah.
And how we can preserve. There's a lot of moving parts to your knee.
A lot of moving parts, and people want to know what's going on, and I use these models in my practice. And one of the common injuries I see is meniscus injury.
What exactly is a meniscus?
Yeah, that's one of the, let me show you. If and again, I think we've got this on camera. I tell people there are 2 different kinds of cartilage in the knee. One is this smooth blue rubbery stuff that you see, for example, on the end of a chicken leg or a turkey leg. And that's what wears away, for example, with arthritis. And different patient populations are going to be more or less prone to that. But the other kind of cartilage are these leather-like pads, and they're represented here. There's one on either side of the knee. And just like leather can tear, these things can too. And you don't have to be in a train wreck to tear those things. For example, they don't have any nerve endings in them. You may stand and turn, answering the phone when somebody calls your name, and that shear, that twisting like that can in fact extend a tear into the body of this leather-like pad called the meniscus. And you might not feel it the moment it happens, but now the knee aches, you may have some swelling. When you try to get into the car, typically people say, hey, I'm getting in and out of the car and I have this sharp pain. Or you may feel a pop. Now, not all pops mean you have a meniscus tear. But when you put that together with joint line tenderness, and I may, during the exam, I'll twist the knee a little bit, look for joint line tenderness, look for that internal swelling, and all those are signs of a meniscus injury. Now, the important thing about a meniscus injury is that most of them aren't going to heal entirely on their own. So those are the kinds of things that people have that procedure, that arthroscopy, about.
Ah, the arthroscopic surgery. Now we've got a shoulder here, I suppose.
Yep, this is a shoulder. This is some other really common things. Let's see, is this good? Some other really common things I see are shoulder injuries, and the shoulder is one of those ball and socket joints, and there's the ball, and everybody has a kind of a shallow socket, and overlying the whole thing is this bony shelf. And there is a space underneath that bony shelf. It looks kind of empty, and it is on the model, but we know it's not in us, of course. Among other things, what lives there is a white, shiny, tough layer of tendon called the rotator cuff. Now, we're all made differently. Some of us have a lot of space for that rotator cuff to live in, some not so much space, and then later some things can happen to further diminish the space. But you can imagine as you bring your arm up, let's say you're going to do military presses or any particular overhead activity, you might irritate that rotator cuff, and I see a lot of that in the office.
So I guess prevention and just being careful and warming up and being aware of your body is more important than getting it repaired, I would imagine.
Yeah, prevention and flexibility, stretches and strengthening exercises are the things I would emphasize.
Dr. Jim Talkington, orthopedic surgeon, thank you so much for coming on the show.
Thank you. I appreciate
getting us smart on all this stuff.
Well, thank you for letting me come on.
You've been watching Waking Up with Don. We'll see you next time.